We always joke in our industry at Freedom Healthworks, and we're all membership, we're all cash, no insurance, really cementing that doctor-patient relationship. But whenever we hear the question of some patient coming up and saying, well, why do I need to pay extra? Why do I need to pay for a membership to come see my doctor? It's the same doctor I've been seeing and they just converted their practice over. I still pay for insurance. And I tell them, every single doctor, memorize one line. Okay. And that line is, because there is no insurance code for healing somebody.
Say that again.
There is no insurance billing code for actually healing a person.
Wow.
So you hear people talk about a SICKCARE system. We don't have a healthcare system. We have a SICKCARE system.
Right.
Emphasis is on specialists in surgeries. When we describe Freedom Healthworks and really what we're doing and why we're emphasizing primary care right now, there's a couple of visuals I like to use. I say that, healthcare is either built like a pyramid or built linear, just depending how people think. If it's linear, think of the alphabet. At A, you have primary care. That is going to be the entry point to the vast majority of Americans' experience with healthcare, or a physician or a medical practitioner. Primary care is at A. At Z, I'm going to put surgeries over there. People can debate that on what they actually need there. But I'm thinking, if you need surgery, someone's cutting into you, that is going to be the most invasive, most severe from a financial and from a physical procedure that you can possibly do. Everything else in the middle, right, needs to start with primary care. But all too often we're going from, well, shoot, I'm sick. I need to go to dermatologist. I need to go to cardiologist. I need to go talk to this guy over here, and on and on and on and on. And people, they treat primary care like I said, like a glorified triage system. And so the other visual I like to use is say that the United States healthcare is basically an upside down pyramid. Now people can probably visual that and say, well, that doesn't make a lot of sense because you're resting on your point, right? And then you're getting bigger as you go up. And I go, that's exactly what we see. We have the fewest amount of resources, money and time, invested in primary care. We treat primary care 5 to 7 minutes, boom, you're down the hall to my colleague who gets paid by the same healthcare, same hospital. And then on beyond that, we spend the vast majority of our time on prescriptions and money, time and money on prescriptions, on surgeries, and on specialists. Yeah. Our mission is to push that pyramid over, get a solid base going of primary care. And then naturally, you're going to spend more time with your primary care physician. That's going to be, again, your quarterback of every care need that you have. And then you're going to form your little care team, your little partnership right there, and see what exactly your next steps are going to be. Now, one of the hallmarks of that, and why it's been a little slow, I believe, to catch on with a lot of employers, because their employer plans are built around brokers making money off of insurance companies, and following my logic here. So they like it when a lot of companies buy a lot of insurance. And so what we're doing is building a model where we emphasize primary care. And so naturally we have fewer and fewer specialists in surgeries, fewer prescriptions. When you have somebody who's a diabetic patient, Shawn, and you work with them to actually lose weight and live healthier, and they're no longer diabetic, who loses money when that happens?
Absolutely. 100%.
So, I said earlier, I think that, a lot of people believe that their physicians have their best interests in mind, but there's somebody in the back saying, hey, you're not meeting your quota for sending people to surgery. And I kid you not, we've had conversations with surgeons, orthopedic surgeons, well-known, that say, Chris, 1 out of 3 people who came into my office for a consultation, our business model was built around me sending that person into surgery, whether they needed it or not.
It's unbelievable. And people don't understand that. They don't want to believe that, or they don't know that just out of ignorance. They would think, oh, well, come on, he's a doctor. He's not going to do unnecessary surgery.